Hello friends and colleagues, I'm Stanislav Chernog, the author and creator of the online school of Vector Massage and Somatics, and today we're starting a new format. A module came to us, on which we observed several diverse and seemingly common manifestations. Firstly, our model has pollinosis, that is, it is now responding to flowering plants. Secondly, our model has problems with atopic dermatitis. She has occasional breakouts, and problems with the fascia of the hands. In addition, we're seeing problems with emerging varicose veins, and there are vascular networks in some places. In addition, we observe changes in posture in the lumbar spine. All this has a common basis, all this happens in one person. Of course, all this is connected. This is the first in a series of videos. Each video will focus on one specific problem and how to work with it in a general sense. In the final video, we will collect all the information and give you opinions about what we think specifically about our model and about exactly what one needs to do. In each video, we will consider a piece of the puzzle, and in the end this puzzle will come together and we will see how to work with a person and what is the logical course of our reasoning, how we came to the conclusions that we came to. Let's start with what worries the model the most, and this is varicose veins. Notice that there is a very distinct local area of spinal veins right here. It is associated with the fact that there are two layers of tissues, the fascia, are fused together. We have grown fascia to the muscles of the back of the thigh. Accordingly, the task of working on these spinal veins is to find the place of fascia growth and detach it from the muscles. Let's show how this can be done. We apply a certain amount of oil and begin to move in the space of subcutaneous fatty tissue. It is here that we have a space where the tissues have grown together, and in some cases it can be quite painful for the patient. Therefore, show delicacy and pay attention. We have worked and the amount of blood in the space has noticeably decreased, because the vessels got the opportunity to transport it upward. Accordingly, such work will be quite effective in the long run. What exactly are varicose veins? First of all, we need to understand that there are two types of vessels within which blood circulates. There are arteries that circulate arterial blood, or blood that travels away from the heart, and there is venous blood that collects in veins and travels to the heart. Accordingly, if we talk about the arteries, then the blood is pushed through them into the heart. If we talk about the veins, the blood in them rises through the veins and moves to the heart by contracting the muscles that are around the veins, and caros is pushed by the muscles and surrounding tissues. And the heart, unfortunately, cannot make any effort to raise the blood. When it comes to the legs, the arterial blood flows down and also drives it, in addition to gravity, the heart. And when it comes to venous blood that rises up, in addition to the fact that the heart cannot help in this process, gravity also pulls the blood down. In order to help the blood move, there are systems of semilunar valves. When the blood is pushed up to the contracted muscle, a special structure called the semilunar valve closes and prevents blood from sinking down. Thus the blood, as if on an elevator, rises from one floor to another. In some cases, the problem arises that the venous blood is not able to rise higher because the place where it should go is occluded or blocked or already overflowing with blood. Due to the fact that the heart and gravity pushes the arterial blood down and the venous blood is unable to go up, the problem arises that the blood has to go somewhere, and the blood begins to stretch the walls of the veins, and in some cases it stretches them so much that there are local internal scars along the veins. In addition, the semilunar valve system is destroyed. Thus, the vein is too large in diameter to accommodate the excess amount of blood, and the semilunar valves do not work. This is what is called varicose veins. The classic treatment for varicose veins is to remove the damaged vein. Basically, people are worried about superficial veins, so they are removed or coagulated with a laser. When the vein collapses and the visual effects are ugly, they are killed more often and the veins decrease in volume or disappear altogether. But nevertheless, the blood could not go up, and it turns out not to be able to go up. Therefore, cosmetic procedures for cutting or collapsing veins only lead to a worsening of the situation. If we talk about how to work with varicose veins, then firstly we need to remove the cause of its occurrence. That is, if there is somewhere where the blood does not pass, we need to relax this place and allow the blood to freely rise up. In addition, in cases where varicose veins have already occurred, there are methods for dealing with scars, which in fact are varicose veins. Let's now talk about what prevents the passage of blood up. And the first reason that can be easily eliminated is a problem with the lymphatic system. Due to the fact that the lymph nodes and vessels are periodically overfilled, and with the lymph that is not able to move away and free up space, these lymph nodes and vessels compress the outflow of venous blood. Thus, work with the lymphatic system can have a significant visible and rapid effect, for example on spider veins. In addition, working with the lymphatic system in the long term can restore the functioning of the veins and remove the visible manifestations of varicose veins. It must be understood that an essential part of modeling a figure is working with the lymphatic system, which at times has an absolutely destructive effect on a person's health and appearance, including varicose veins, is largely provoked by a violation of the lymphatic outflow from the inguinal region. Now I will show you some tricks for working with the lymphatic system. It must be understood that these techniques are taken out of context. If you want to really do quality work, you have to learn. Link to the marathon in the description. So in order for us to improve the lymphatic outflow from the lower extremities and thus unload the road for the passage of venous blood, we need to work with the inguinal lymph nodes. Inguinal lymph nodes are located on the inner surface of the thigh. Work with the inguinal lymph nodes is carried out primarily through a very soft and delicate laying on of the hand. Many of you may think that he puts his hand on the inner surface of the thigh and like the varicose veins will immediately disappear. What nonsense is he thinking? Actually, it really works. How does it work? At the moment, when we put our hands on the inguinal region of our model, we not only impose physical activity, we activate receptors that are located in the subcutaneous fatty tissue and in the lymph nodes. Accordingly, the brain reacts and begins to contract the smooth muscles that are part of the lymph nodes. In addition, we intensify the work of the aliphatic system due to the fact that the body begins to push arterial blood more efficiently through this area. After a while, the lymph nodes begin to empty. Such a very static and practically energy-intensive work can be extremely productive. So some time ago, several of my students got together and started working on this technique with each other, and with surprise and admiration found that the spider veins decreased significantly in size within 2 weeks. This is just one of the possible causes of varicose veins, and the next reason to talk about is the excessive tension of the muscles between which the veins pass. We must understand that when it comes to the thigh, there are several muscle pockets in which the muscles are located. First, there is an extensive quadriceps pocket. In addition, there is a pocket of the adductor muscles. There is a myofascial pocket of the muscles of the back of the thigh. This is a semimembranosus and biceps femoris muscle. We need to separate all these muscles from each other so that if there are adhesive processes and if these muscles are tense, so that the veins can freely carry blood through these structures. We do this by working in the space between the muscle pockets and separating, for example, in these cases I now show, the medial head of the quadriceps and the adductor magnus. How often and for how long should muscle separation work be done? First, we need to understand that if there is soreness in the space between the internal head of the quadriceps and the adductors, then there is likely to be excess tension. You see, we have found several points. Here is a distinct example. I am sure that it is perceived as a pulling and stabbing sensation, and just at the moment when you find pulling stabbing sensation while working with the inner surface, this means that two different muscle groups have grown together, and the adhesion, which is this with a distance, prevents the movement of venous blood. You need to understand that in order to carry out this work, you need to have a good understanding of the anatomy of how the hip works. You need to understand where the arteries and veins are located. You need to understand that this area is quite densely saturated with lymph nodes, and if you do not take into account their location, then this work can be dangerous for your patient. Once again, I repeat that we talk about all this in our wonderful course on figure modeling. The next point to pay attention to is the condition of the intestines. I must say that in a huge number of cases, it is the condition of the intestine that is an obstacle to the normal outflow of blood from the veins. If the bowel is lowered, if a person has excessive diaphragm tone, then the bowel displaced downward will prevent the normal outflow of blood from the lower extremities. Therefore, work with the diaphragm, work on lifting the intestines in most cases of problems with varicose veins is absolutely necessary. We must understand that we can work with the inguinal lymph nodes, we can work with the inner thigh or separate, for example, the back of the thigh, separate the muscles from each other, and if the problem is not located in the legs, but in the intestines or in the lower back, as soon as we stop working on the legs, the problem will return to normal. How can we understand that there are problems with the intestines? Firstly, if on palpation we find soreness in the tummy, then this in itself is a bad sign, or it is a good sign that you should work with the intestines. If you're pressed on your tummy, if you're pressed in the middle, if you're suppressed from the side and you have pain, then this is a sure sign that you are not living at full strength, that your body is poisoned by decayed products, that the blood does not flow normally from your feet, and you reduce your lifespan and degrade its quality. What could be the reason for the problems that blood does not flow normally into the abdominal cavity? In the case of our model, this is due to the fact that her pelvis is rather strongly thrown forward. This causes the intestines to move down, and this leads to the fact that blood cannot pass through the displaced internal organs normally. Accordingly, in order to rid our model of problems with spider veins, so that they do not grow and at best disappear altogether, we first need to work on the lumbar spine and return the position of the pelvis to its place. At this stage, I can confidently say that varicose veins are the result of a violation of posture in the lumbar spine. In the next video, we will examine posture in detail and confirm or refute our judgments. Subscribe to the channel not to miss this interesting study to stay up to date. And with you was Stanislav Chernog, the author and creator of the online skill Vector Massage and Somatics and the YouTube channel of the same name, a channel where we explore health, learn to heal and be healthy and earn good money at the same time. I will be very grateful to everyone who will write in the comments your versions about where to look in the body of our model in order to help and change the situation with your health. Until we meet again, friends, goodbye.